Hello, everyone. Thank you for joining us today. I'm just going to give it a moment for everyone to get signed in. If you could please enter your name and the organization that you're here representing into the chat box, that would be wonderful. And we'll get started here momentarily. Great. It looks like everyone's getting signed in. Well, good day, and thank you for attending today's webinar on integrating climate justice into environmental public health programs. My name is Nicole Dutra Marquez, and I am a senior project coordinator here at the National Environmental Health Association, and I will be moderating the webinar today. The agenda for today's webinar includes 3 guest speakers who will share best practices of how they have inset environmental justice into their climate health programs to be able to better serve their communities. The presentations will be followed by a Q&A session. Upon completion of the Q&A session, we will share with all of you a new resource developed by NEHA for environmental public health professionals, and share information about the 86th Annual Educational Conference that's going to be held later this year in New Orleans, and provide a closing to today's webinar. Allow me to cover a few housekeeping items before we get started. Please note that the webinar is being recorded, and the recording will be uploaded to the NEHA website. We will take questions upon completion of the presentations. Please feel free to drop any questions that you have throughout the webinar in the Q&A box, and we will address those as soon as the presentations are completed. At the conclusion of the webinar, you'll be directed to take part in a short evaluation. Please complete the survey, as we would really appreciate your feedback, your suggestions, and comments. So let us begin today's webinar. Today we have 3 guest speakers, Vicki Raya, Julie West, and Dr. Motria Caudil. Vicki Raya has over 17 years of experience working with diverse communities locally and nationally. She brings expertise in developing community-led educational programs, designing inclusive and meaningful engagement strategies, and working within government agencies to advance racial equity across policy, planning, capital investment programs, and within the workplace culture. Currently, she leads climate equity initiatives in partnership with frontline communities at King County. Her background includes leading high-impact engagement programs and facilitating complex project collaboration with climate justice leaders, community-based organizations, and public and private organizations. Julie West has a master's in public health and has been with the Environmental Health Services Division of Public Health in Seattle and King County for over 20 years, focused on supporting equitable and healthy land use and transportation decision-making and community partnerships to enhance outreach on environmental conditions and environmental justice. She is co-managing the development and implementation of a department-wide interdisciplinary climate and health equity initiative to support health protection, prevention, and preparedness programs that minimize the adverse health impacts associated with climate change, particularly among frontline communities. Our final guest is Dr. Motria Caudil, who has been an environmental health scientist with the federal government for 22 years, first at the U.S. Environmental Protection Agency, and has currently been with the Agency for Toxic Substances and Disease Registry since 2015. Her daily work involves assessing people's exposures and potential health risks in communities with contaminated soil, air, and drinking water. Motria's career highlights include training environmental health specialists in Asia and Eastern Europe, supporting enforcement actions against domestic polluters, and working with local partners on health education projects. With that, please welcome Vicki Raya. Today, Vicki will start off presentations with an in-depth explanation of what is climate justice. So Vicki, the floor is all yours.
Thanks, Nicole. And Julie, would you please bring up the first slide in the presentation? I want to make sure this is up in front of folks as we go into that. Thank you so much. All right, welcome everybody. Again, my name is Vicki Raya, Climate Equity and Community Partnerships Program Manager for King County. Long title, but it tells you everything I do. And so, I know that many of you have heard the term climate justice, environmental justice. We also talk about things like equity, racial equity, et cetera. And so before I get into what climate justice is, I want to talk about what we mean at King County by climate equity, and more broadly, what we mean by climate equity. And you'll notice that if you look through any of King County's climate action planning, publicly available information, we often use climate equity more frequently than we claim climate justice. And hopefully it'll become more clear why as we go along. So to begin with equity, this term has thankfully become more commonplace. Climate equity means that we are ensuring that all people have access and opportunity to benefit from climate solutions while not bearing an unequal burden of the impacts. It does mean that we need to understand the relationship between those who contribute most to an issue and how we invest in the people that are most impacted by an issue. To take it a step further, it means that we develop co-benefit solutions for people and for the environment that are distributed equitably. So as an example, if we establish a heat pump installation program for residents, we prioritize priority populations, or those we would call vulnerable populations, and geographies to ensure that these communities have the first opportunity to benefit. So that is, in essence, climate equity. Now, climate justice means that we need to take a step back, and we need to also acknowledge and recognize that there is an ongoing legacy of systems of oppression and environmental exploitation. That means that we not only say we need to make sure that we invest equitably, which is really, really critical, but that we also center the leadership and the voices of the people that are most impacted in developing what those solutions are, in making and determining where those investments should go, and in what those actions should be. So harking back to the heat pump example, climate justice would look like, yes, making sure climate equity would mean, let's make sure that priority populations have first opportunity for these programs and ensure affordability. But climate justice would say these members of frontline community, and when we say frontline, we mean, immigrant, refugee, Black, Indigenous, people of color communities, LGBTQIA communities, people who are at the margins of decision-making and power. And we say that these are the communities that are going to help inform what these programs look like and even what they are. So a little later on, I'll share an example of community leadership on climate action at King County that really gets closer to this definition of climate justice. And next slide. All right, so, thanks, everybody. So again, we're going to talk a little bit about what climate justice looks like in health. And Julie is really going to be the person, Julie West, who's been doing this work for a lot longer at King County than I have. We'll go into detail about what it looks like. But before we get there, I'd like to explain a little bit about the climate justice framework that we've developed at King County. Next, please. So at King County, we developed a vision for what it looks like, for what climate justice looks like. And this was done by cultivating a section of our climate action plan that is called the Sustainable and Resilient Frontline Communities section. It's a mouthful, but again, it also tells a better story about what this section does. So we have a 5-year climate action plan that we update. The most recent version of this was in 2020. And for this version, really there was a dedicated effort to embed climate justice. And this meant that for the better part of a year, the person that was leading this effort really spent time cultivating authentic relationships that were trusted with members of frontline communities. This meant climate justice leaders and leaders of community-based organizations that were doing work, particularly in South King County, where we have a concentration of frontline community members. And so these members came together eventually formally to create a body called the Climate Equity and Community Task Force. And really their role was to co-develop what this section of the climate action plan would look like. And as you see, their vision was that frontline communities were centered in developing these solutions, that they had the resources that they needed to really adapt, to lead, and to thrive in a changing climate. And the picture here is of some of our original members. And this is still a body that is working at King County today. Next, please. And so as a result of their effort, the SRFC, Sustainable and Resilient Frontline Community section, was developed, and it is ambitious. There are 8 focus areas that the task force helped to determine. And give you a brief explanation of these 8 areas. So the first one, if you look at the top right, is community leadership and community-driven policymaking. So ensuring that at every step, King County is improving the way that it centers community in building climate solutions, and that it centers community in its policymaking. Focus area 2 is about community capacity development, and this means that we increase and expand culturally relevant education on climate with frontline communities, but that we also increase and expand climate justice education internally with King County staff so that we can do a better job of increasing and expanding this work. Focus area 3 is around equitable green jobs and pathways, and this means that with a changing economy at King County that's really transitioning aggressively toward green jobs, that we put strategies in place to ensure that we continue to provide benefit and center frontline community members. Focus area 4, and I think this is one that I'm sure is near and dear to your heart, is community health and emergency preparedness. So how do we ensure that community has the resources that they need and is able to identify the solutions and the strategies that are needed to be able to adapt to climate-related emergency events? Focus area 5 is food systems and food security. So this is not only about having nutritious, affordable foods available to community, but also that they have ownership of land to grow culturally relevant foods and to participate in their local food economy. Focus area 6 is housing security and anti-displacement. And this is really about ensuring that as we go about greening buildings, building efficiencies, building a better public transportation system, that we are also ensuring that we're not pushing frontline community members out of those areas that are now receiving resources. Focus area 7, energy and justice utilities. As we transition away from fossil fuel use into electricity, and as utilities themselves are really focused on being able to adapt to a rapidly changing climate, that what that will do to affordability and to expenses does not forget that we need to ensure that the affordability is at the core of this for the communities that are going to be most impacted. Focus area 8, transportation access and equity, really has 3 elements. One, again, it's that community leadership element, that communities involved in decision-making and planning for our public transportation, that we are making investments that are equitable, meaning that they're going toward places where we have long disinvested, and 3, that our infrastructure really changes to adapt to the changing climate. So, for example, our bus shelters are adapted to really be able to protect people from intense heat or intense rains. All right, and next, please. And so all of this work really just became one of the pillars of our climate action plan that was approved by council in 2020. So in our climate action plan, traditionally up until this point, the plan is all about greenhouse gas mitigation, which is really, really critical. But climate justice, or not even climate justice, but equity, is really just one sub-element of this plan, as has climate preparedness been. In this new plan, we have 3 equal pillars where we provide investment, visibility, and resources for mitigation, but also investment, visibility, and resources for climate justice, which is that center purple part, and then investment and visibility and resources for preparedness. And so this really is climate justice in action, where the voice of community you now see as central to a climate action plan that all of the county is responsible and accountable to. Next. All right, and I'm going to pass it on to Julie for giving you many more examples that are related to health on this work.
Great. Thank you, Vicki, and thank you to Neha for the invitation to talk today and to share about our climate and health equity work at Public Health Seattle King County. Our health department is the local health department that serves Seattle and the other 38 cities and towns in King County. And if you've been here, you know it's a very beautiful place to live and visit. We have very vibrant communities, beautiful parks and mountains, water for recreation and travel, but increasingly responding to more and more climate-related events. Today I'd like to share about our department's Climate and Health Equity Initiative that has formed to help in that response. I've included here the broad vision for this initiative and the values that guide our work towards that climate equity, climate justice that Vicki described. And at the top of that list is leading with racial justice and equity. As I describe the initiative, I'm hoping to give a sense of what we are doing, give some examples, and share some lessons learned along the way that may be helpful. So I wanted to first give a sense of our story and how we arrived at having this initiative. And we've been engaged in climate-related work off and on for over 10 years, but without dedicated staffing. So it has taken some time to get to this point. And in 2015, we were asked to review and provide some feedback on that first strategic climate action plan for the county. And we were primarily asked to look at preparedness actions. But after that involvement, we realized that we needed a more defined roadmap for our health department. So we took some time to develop a blueprint for addressing climate and health, and that created a report that has those high-level public health strategies. We finalized that report in 2018, and I'll talk a little bit more about that on the next couple of slides. Then more recently, as King County began updating the SCAP, the Strategic Climate Action Plan in 2020, we were more prepared with the blueprint actions, and so we could fold more into the new plan. So we formally launched this Climate and Health Equity Initiative at the beginning of 2022, as we received some funding to prioritize staffing time for climate work. Along the way, we've experienced a series of climate-related events, mostly related to wildfire smoke and extreme heat. But during those events, we have been very reactionary, and so now wanting to move to a more proactive role. So I mentioned the blueprint report was created in that 2016 to 2018 timeframe and was very focused on the essential public health, essential environmental health services. This meant considering the foundational public health capabilities for health agencies as the framework to identify strategies and actions to guide our work. This helped to really better define our role versus the other government agency roles. And it also helped us consider how we might integrate climate change and health into everyday work of staff. And from the beginning of this report, we wanted to make sure our strategies were centered on equity and social justice and on our frontline communities. In developing that blueprint, we talked with public health leadership and some community leaders through interviews, and we did some surveying of staff and community to get perspectives on what should public health's role be and community priorities. But a really important step was to look at reports that were available, especially local reports. For example, the Our People, Our Planet, Our Power report had just been released. It laid out the findings from some community-led research facilitated by two local organizations, Puget Sound Sage and Got Green, and their research focused on how our communities were experiencing climate change. So the stories and recommendations in that report greatly influenced our blueprint. So key for us was the importance of seeing what already exists, especially these community-led assessments and reports. So our Climate and Health Equity Initiative is housed in environmental health, but is a department-wide initiative. Our team is comprised of staff integrated into existing programs and provides a very interdisciplinary approach that works across many fields of public health practice. So there's folks from environmental health, our assessment team, preparedness, and also our communications teams. At this time, we're focused on these three core service areas. So data monitoring of climate-related health impacts, increasing access to risk communication, and climate response and adaptation. And our work in these areas aligns with the strategic climate action plan that Vicki just described. And we have SCAP actions that we are leading and reporting on. In our data monitoring function, so I'm going to go through each of those just real quickly. We're focused on who is being harmed the most by climate change, how exposure to climate change impacts differ across communities, and what conditions are contributing to the disparate harm. Our current work includes finalizing a list of health indicators for ongoing data monitoring, incorporating data into community reports, and expanding processes to allow us to provide more near-time data during climate events. As an example, I wanted to share the 2021 heat mapping study that the King County climate team, that's just the broader climate team that Vicki is part of, conducted. And the high-level results of that are shown in this first map. It shows that many of our South Seattle and South King County urban neighborhoods get much hotter in heat waves compared to other areas of King County, likely because of fewer trees and more pavement. Then we see in the second map, data from our public health assessment programs that capture heat-related illness versus via some emergency department visit data. And we begin to see these connections. We also know that these areas that are more vulnerable to urban heat island and higher heat illness have more communities of color, as Vicki mentioned earlier. And historical and environmental racism has played a role through segregation and redlining. Although these maps can't tell the full story of our communities, they can begin to show the impacts in a community and guide future decision, especially for long-term risk reduction efforts. In our second area, our communication work aims to draw very clear connections between climate change and health. We want to provide actionable information to help communities reduce exposure and engage with communities in a relevant and accessible way so that our messages are reaching those most at risk. This often means checking our own assumptions and beliefs about what information is most valuable to empower our communities to take action. So key for us has been to use co-development processes, working with community-based organizations who can offer insight regarding the best ways to reach communities. An example of this is one focused on urban heat islands and our vulnerable older population. And in 2017, we worked with City of Seattle and Puget Sound Clean Air Agency in our area to learn about residents' knowledge of heat-related protective strategies and also identify factors that might make them more vulnerable. And this was really focused in our Chinatown International District and nearby communities. Then, along with University of Washington colleagues, we developed culturally appropriate prevention messages that were reviewed by these community partners. And this led to the Stay Safe in the Heat comic that has been translated into 11 languages. And we've continued to this day to distribute these mini comic books with community-based organizations at senior centers, libraries, parks departments, and clinics. We also use the messages in multilingual media ads and in social media posts, and also share the graphics so partners can use themselves. And finally, in our focus on response and adaptation, our goal, as mentioned, is to move to that more proactive long-term risk reduction. So we've begun development of recommendations and action thresholds for non-traditional hazards for us, and looking for opportunities to address the quality and condition of our built environment, such as through comprehensive planning policies and building codes. But we've also engaged in direct distribution of resources to address these existing access gaps. So an example of this is our distribution of box fan filter kits, which is a low-cost way to create clean air indoor spaces, especially for us during wildfire smoke events. This effort started in response to wildfire smoke in 2020 and was built onto existing community connections to reach residents disproportionately being exposed to smoke during the COVID pandemic. So since then, we've distributed over 2,700 kits to priority populations, including people experiencing environmental racism, families with young children, people with chronic illnesses, older adults, multi-generational households, and outdoor workers. We've partnered with over 30 community-based organizations to identify, reach, and disseminate the kits. providing funding to support their efforts to do that. And we've conducted some direct distribution ourselves and outreach at health fairs and collaborating with other organizations. This year, we're also engaging in an air monitoring pilot collaboration with the University of Washington faculty and students to work with some households to better understand the effectiveness of the kits, identify barriers, and improve our efforts to improve the indoor air quality. So our work on climate justice and health equity has definitely been a journey for us, and we are continuing to learn. Elements that have helped us with success are that building equity into our program from the beginning and continuing to weave equity practices into our strategies and investments, and taking the time needed for meaningful partnership development and finding ways to maintain these partnerships. This includes that co-development and funding communities to work with us. And that really enables us to make sure that what we're creating is relevant, equitable, and really supports the climate and health priorities in our communities. We're very focused on capacity building and action, and that includes within our agency and with community. And finally, we know that communities who are already experiencing health and environmental inequities are often already experiencing climate inequities. So we have focused on helping to meet those current needs and getting folks resources they need right now while learning how to address the longer term issues. So I will stop sharing, and that's the end of our slides. I will send it over to Nicole.
Great. Thank you so much, Julie and Vicki, for a wonderful presentation. Next, we will move on to our final presentation today. Please welcome guest speaker, Dr. Motria Kodil from ATSDR. Motria, the floor is all yours.
Thank you. Okay, I think I'm sharing.
Might switch it to presentation mode. Perfect. You got it. Thank you.
Okay, thank you. I have 3 screens here. I think I'm looking at the right one. Thank you so much for inviting me to speak today. And I took a quick look at the attendees. I'm happy to see at least one of my fellow Midwesterners. Hello, Wisconsin. The way that we had envisioned these presentations fitting together is the first speakers were they're from a local agency and they're talking about what they have been doing, and that was hopefully we'll have some good discussion once we get through all the presentations. What I was hoping to present is giving you a bigger picture about environmental health and climate change and environmental justice and how these topics overlap, and to provide you with some resources to better understand what are the environmental health issues in your part of the country and how are resources. So hopefully you'll be able to take these great examples from King County and apply it in your communities.
Motria, may I just comment? You were phasing out quite a bit. Maybe if you shut off your camera, that might help with the bandwidth. Okay.
Yeah, even though I'm at the office today, for some reason, our internet is a little goofy sometimes. Okay, so very generally, climate change, together with other natural and human-made health stressors, influences human health and disease in numerous ways. There are some existing health threats that, as climate change proceeds, will become more intense, and then there are other health threats that will emerge. For example, we have wildfires were not that widespread of an issue in the Midwest, especially here in Chicago. It's not anything that we really thought about very much, but the wildfires that do occur in the Wisconsin, Minnesota area have become more intense, and And we are impacted here by wildfire smoke the last couple of years, the very extreme events in California and the Pacific Northwest. So these are things that have always happened, but you know they are much more extreme than ever, and they're affecting areas to a greater extent than they did previously. So these health threats are changing, and not everyone is equally at risk. There are important considerations about people's age, economic resources, and location. Before I get into some of the specifics of environmental health issues that are impacted by climate change, we'll just say very generally, there are a few different health effects that a lot of these different climate changes can influence. Some of the most important impacts on health include increased respiratory and cardiovascular disease, injuries and premature deaths related to extreme weather events, changes in the prevalence and geographic distribution of food and waterborne illnesses and other infectious diseases, and threats to mental health. So these are the common themes across the different environmental impacts related to climate change. This is the first of the resources that we will be, I'm not sure if we're providing slides, but definitely we'll be able to send you links. This is a very good website for you to learn in more detail about the different environmental health impacts related to climate change. And so this is the climate effects on health page from the Centers for Disease Control. And it really is a wide range of topics. I've mentioned wildfires, extreme heat and extreme cold events. Air pollution is made worse, and the presence of allergens and disease vectors are made worse by climate change. The extreme weather and events include major rain events. The flooding related to that in and of itself is a hazard, and then the food and waterborne disease that comes with water. Flooding is a factor, and then all of these extreme events can have mental health and stress related disorders. Finally, food security is a concern. There's parts of the country where you used to be able to store fruit in a warehouse, and it was you didn't have to worry about the extreme heat even in the early springtime. And so food that used to be stored and transported in a certain way now needs to be, we need to adjust to avoid spoilage and to avoid loss of food. So a lot of things that you might not have even considered. Every region of the United States experiences climate change and its impacts on health differently. We have different threats, different priorities, and then you know your own communities, you know the demographics, you know what populations you have that may be at additional risk. So this is another resource that we'll be sharing with you. It's another CDC resource, Preparing for the Regional Health Impacts of Climate Change in the United States. You can look up region by region, what are the key risks in your area. In the Midwest, we have, we've been kind of lulled into a sense of security about the heat extremes. We haven't, in recent years, we haven't had major heat waves in the summertime. We have had earlier spring and later fall, but it's the major heat impacts that you're seeing on the West Coast have not been touching us. On the other hand, we have been having major floods and major rain events. We'll have, and this can affect wide populations, and then it will be especially severe in a community that may already have a contaminant issue. I was recently consulting on a Superfund contaminated site where there was an additional risk related to climate change, where there's the possibility of contaminants leaving the site where they were contained and potentially impacting nearby properties, including nearby homes, because they had massive rains and massive flooding. And we've seen these statistics. This particular area had what was termed a 500-year flood, but it happened twice in a matter of a couple of years. So those records and those extremes are happening more and more frequently. And that is related both to temperature extremes, to droughts, and to flood events. Groups at increased risk include those with low income, some communities of color, immigrant groups, including those with limited English proficiency, Indigenous peoples, children and pregnant women, older adults, vulnerable occupational groups, persons with disabilities, and persons with pre-existing or chronic medical conditions. So this is another resource that I invite you to read in the future. And for your specific community, I hope you'll be able to put the pieces together and identify what are the environmental hazards that are going to be made worse and exacerbated by climate change. And then what are your populations that are at risk, either from an economic or demographic point of view, or in terms of their age and their medical conditions. My last few slides are going to give you an example of the kind of health education we've been working on in the Midwest, in the Federal Region 5 area. One of our priority environmental health issues related to climate change is increased air pollution. Increases in ground level ozone and particulate matter are associated with the prevalence of various lung and cardiovascular diseases. This can lead to economic losses, lost school days, hospitalizations, and premature death. In the absence of mitigation of climate change, ozone is projected to increase across the Midwest, resulting in additional premature deaths. So this is taken from that report that I shared the link previously. And then to learn a little more about these contaminants. Ground level ozone can make asthma, bronchitis, and emphysema symptoms worse. It has been linked to lung and throat irritation, wheezing, and trouble breathing during exercise or outdoor activities. Your most sensitive populations include people with asthma and other lung conditions, older adults, anyone who exercises and works hard outside, babies, and children. In our conversations with state and local health partners, they've raised questions about migrant workers, people who are day laborers, and it's really been a fruitful conversation to hear from these local agencies about their knowledge of these populations that are at risk and talking about how we could better reach them. These particular slides I'm sharing right now, this is an approved slide deck that I've been sharing with our health partners to introduce them to the priority air pollution issues in the Midwest. And then we try to brainstorm about how best to reach the populations that are at increased risk. So ozone is a priority pollutant, and then fine particulate matter. These are particles smaller than 2.5 microns. They can travel all the way into the alveola, the deepest part of the lungs, and even cross into the blood. PM 2.5 can cause premature death in those with heart or lung disease and increased respiratory symptoms. People most likely to experience health effects are those, and this is similar to the ozone sensitive populations, those with heart or lung disease, older adults, babies, and children. Now, the good news about air quality is that we have very readily available and easy to use information to share with the public. The EPA and other partners have developed the Air Quality Index. These are color-coded categories that inform people about air quality in their area, which groups may be affected, and steps to take to reduce exposure to pollution. It's there's a website that has real-time information. There's an app that people can put on their phone, and we've been sharing this information. And this is an example of an environmental health topic where there is a lot of great readily available information. Other topics, I do invite you to reach out to ATSDR and our sister agency, the National Center for Environmental Health, those other topics that that I've listed on the previous slides, the information is not necessarily real time, but there is useful information on there about the risks and who are the populations who need the most support. So we'd be happy to follow up with you if you have specific questions in your area. So a little more about what we've been doing in Region 5. We've presented this information about air pollution and health and about those real-time resources to find out current air quality with health, state and local health departments, and focusing, of course, on areas where ozone is known to be elevated. There's a few dozen counties in Region 5 where ozone is above the EPA standard. So these are called non-attainment areas. So that, of course, is a focus. And within these areas, we're trying to reach environmental justice communities where, in particular with ozone, the issue may be that asthmatics are at risk from ozone exposures, and it's important for them to be on preventive medication. And communities that have limited medical coverage, who may not be able who may not have insurance and the ability to acquire those medications, they will be at risk from ozone effects. We've presented to medical providers and took part in a community health fair at a federally qualified healthcare center in Wisconsin. This particular community center primarily serves the urban Native American population. And so this time of year, I'm looking forward to be doing more of that in the Midwest. So that's going to wrap it up for my presentation. And please do reach out if you have any environmental health, climate related issues in your region or state that you might want to learn more about. Thanks for your attention.
Great. Thank you for such great content, Motria, and thank you for all the resource links that you have shared. To everyone in the audience, we have supplied those links to the resources shared by Motria into the chat box if you would like to get them from there. Let us begin our Q&A session. Just as a reminder, please utilize the Q&A box to drop in any questions that you have for our speakers, and we will address them in the order that they come in. And your participation is greatly appreciated. So we already have some questions, so we'll go ahead and get started. From Samaya, I'm actually from the greater Seattle area, and I have experienced people in many communities, including my own, voicing a distrust or contempt for government. What steps do you take when approaching community groups for projects to ensure a trusting and collaborative experience? And I'm sure this was probably aimed at Vicki and Julie, so if either of you would like to address that.
I mean, it's a big, big question that you're asking. And, there are many incredibly valid reasons for communities to have distrust of government, in the past and certainly now. And so some of the practices that I would say that we utilize at King County, and I'm not going to say universally, we have, 14,000 employees at the county, many, many different programs, and they all do engagement differently. I will just limit myself to talking about the climate work that we do at King County. So the way that the county decided to work specifically on the climate plan was to first cultivate relationships with people in community. Most of these were communities of color that are already doing climate justice work, environmental education work, or community-based organizations that are providing human services to their own communities that are generally these frontline communities. And so the way that this work was done is that first it's about cultivating relationship building and trust building, because to your point, you can't do good work without trusting relationships. If you don't have trust, then you won't be able to really get very far in the work that you're doing. There will always be barriers. And so the idea was to first have relationships that were trusted, that were empowering, and that were authentic, where the person that was coming from the county and saying, I want to build relationship, was really somebody that could speak to that and certainly was authentic in their desire to do it and would advocate at the county level for elevating the voices of these communities. Once that happened, there was a formal body established, and now we have this formal body, and they continue to provide input, and they often will connect us to other communities. But the idea here is that you're really resting a lot of this work on the relationships that already exist in community, and you never want to come in as the expert from the government to tell community what needs to be done. You have to first cultivate the relationship, understand what the needs are, and then work together to develop the solutions. That's certainly the way that we approach climate work. But I'll stop there and I'll pass it on to Julie.
Great, thank you, Vicki.
Thanks, Vicki. And that is definitely the way that we are approaching this work. And thank you for that really important comment and the question. And we are approaching this work similarly as Vicki, and we're very fortunate to be able to work with Vicki, the task force that our community task force that she facilitates. And we also have really some other great models of work that have been done at public health that do exactly what Vicki was describing about taking that time to build those partnerships and those collaborations, finding and prioritizing in our work early about how do we fund to work with community so that we're not just creating something and taking it out, and that it's being created together. So I think that's definitely part of the value that is important to us as we do this work. And I think the other piece of it is that there are, especially in our area, there are some community-based organizations that have been doing climate work for a long time, way before we did. And so finding out like how, if there's any way we can support their work. And I think that's important too, because there are folks who are much further ahead in this work than us, and that the communities trust more than potentially government. And so how can we support work that's already happening in the community is another big piece for us. Thank you for that question.
Thank you, Julie. We have a few more minutes left for Q&A, so let's try to get through the questions here. And I believe this one goes to Julie as well, from Carla. Where did the funding come from for the resources like the box fan filters?
Early in the process or the distribution, we were able to connect it with some of our COVID funding that we were receiving, because we had communities that were experiencing disproportionately higher cases of COVID. We were also having the smoke at the same time, so we had some funding through that. And then since then, we've also received some funding from our State Department of Health, and also we have some in the state of Washington, some foundational public health service funding that is helping with health departments on creating services to do, and climate work is one of those bases. So we're able to use some of that funding, and that funding we've used to help with the box fan filter kit purchases, and also helping to pay community-based organizations and other types of partners to help us with that distribution.
Great, thank you, Julie. I believe this is another question for you, Julie. This is from Maisie, can other health departments and organizations utilize the heat comics strips that were created?
I saw that question in there, and I actually messaged our risk communication manager to figure out like how to go about doing that. And I think my short answer is yes, and they are on our website. But I wanted to just get a little bit more detail, because I imagine if you wanted to use it, maybe you needed more than just the website. So I'll follow up with that if you want to. I can put my email in the chat if you want to follow up with me, and I'll get more defined answer for you. But thank you for that question.
Of course. Leon just has a comment for the presenters. Your discussions were great, expertly presented with extremely good visuals and slides. Thank you very much, from Leon. Dr. Caudill, could you expand on the types of strategies that are presented in ATSDR's I'm Air Aware resource that are intended to help mitigate the impacts of air pollution for population groups who face higher risk of health effects?
I'll give an answer that ties in to the earlier discussion of how to get people to trust us. I found a useful strategy is to engage the medical community, and that's for two reasons. One is the research has shown that information about the air quality index and how people who have a pre-existing condition should pay attention to the air quality and take action to remove themselves and not be exposed if there is a poor air quality day. That information, that messaging is better received, and people are more likely to act on it if they hear it from a medical professional. And so we've been, that's why I prioritize working with federally qualified health centers. And also knowing that in medical school, in medical training, environmental health is not a major topic that's being covered, but these are people who can be very helpful to get the message out. Mm-hmm. So we've been taking every opportunity to talk to people who are health educators for asthma management, or medical providers who work with people who have pre-existing heart and lung conditions, to improve as health professionals, to improve their literacy of environmental health issues. And this is specific to, it also applies to a lot of other, to lead in the environment, to smoke and other contaminants that people may be exposed to in an emergency event. There's a lot of different environmental health topics where partnering with health providers and okay, I stopped my video in the middle of the sentence there. Health providers, and also another useful partner I've been working with more are poison control centers, and that's again specific to an emergency situation. If people are in a community that is in the middle or in the aftermath of a fire of some type, then they don't just want to hear from the regulatory agency that's doing, or whoever's doing the cleanup. They want to talk about their symptoms or their concerns with a medical person. So it's been important to reach out to the poison centers and give them a heads up and let them know what kind of questions they might be getting, and to equip them with the information. That might be a little off tangent here, but that's something that in the broader picture of trying to engage the health provider community has been a really useful route.
No, those were very great tips. Thank you so much. And thank you all for a very great panel discussion. For anyone that has additional questions for our speakers, if you conduct the survey following today's webinar, there is some comment boxes that you could provide those questions, and we will make sure the presenters receive them. Next, we will share with all of you a sneak peek of a new NEHA resource developed for climate health, environmental health professionals. So as climate change continues to impact the environment and public health, especially some population groups more than others, NEHA wanted to provide environmental health professionals working in state, tribal, local, and territorial health agencies with this resource guide, integrating environmental justice and climate and health in public health programs. This guide provides examples of how environmental justice and climate and health can be integrated into core environmental public health programs and services to improve public health outcomes. The guide for state, tribal, local, and territorial workforce professionals includes best practices for incorporating environmental justice into core programming around air quality, food safety and foodborne illness, water quality, hazardous materials and waste management, vector control, and emergency preparedness and disaster response. Environmental health professionals can learn about NEHA's Climate Health Adaptation and Mitigation Partnership Strategic Framework and use it to identify their community's unique climate-related health risks, develop responsive climate adaptive plans, and implement targeted adaptation actions to protect their communities from environmental health risks related to climate change. The program provides an opportunity to share lessons learned, stories of impact, and resources to help other environmental public health professionals respond to the health effects of climate change in their jurisdiction. You can find more information on NEHA's CHAMP framework at climate change, neha.org/climate change. We'll put that link into the chat. Again, we would like to thank our speakers for their presentations today, Vicki Raya, Julie West, and Dr. Motria Caudell. We really appreciate your time and your energy and all the content that you've shared today. And thank you all for attending today's webinar on integrating climate justice into environmental public health programs. And again, attendees, you will receive an email with a link to that survey. Please fill it out, as we would really appreciate your feedback, comments, and suggestions. Thanks again for joining us today, and we will see you next time. We hope you enjoy the rest of your day. Goodbye.